Good morning. My name is Paquita Mansouri. I'm from Children's Bureau. My position is a Child Development Program Supervisor for the state program. And I'm here to continue building relationship and learning and understanding more about our communities and our partners here.
Thank you. Good morning, everybody. My name is Leah Evans. I'm the Family Resource Director at the YMCA of Metropolitan Los Angeles, and I'm always eager to learn about best practices for effective family engagement.
Hello, my name is Helen Aceves. I'm from the Institute for Healthcare Advancement. I oversee as the director for the La Habra Family Resource Center. We are part of the FACT network, so we are one of 15 FRCs in Orange County. My program serves 9 cities in North Orange County. We're a hub location for 2 programs. I just want to see, one is I've heard of the great work that this initiative has done, and I want to look at those best practices as well and see how those are applied to community and see what I can take back and also implement.
Hi, I'm Lita Albright. I'm the director, one of the directors of Strategies 2.0. We do training, consulting, and learning communities statewide. Welcome, everyone.
Hello, I'm Vanessa Mendez, the Director of Community Services for Los Angeles at Children's Bureau, and I'm here to support the MCI team and the strategies team and just continue to learn about the network. I feel that every time I come to one of these convenings that's related to MCI, I learn more. So I'm excited to find out what I'll learn next.
Okay, I'm going to pass the microphone on. Come on in. Just make yourself at home. And we're going to come right over here, and I'm going to swoop in right here.
Hi, good morning. My name is Anaide Gomez. I'm here from Children's Bureau. I'm the supervisor for Family Enrichment Program, and I'm here to continue learning about the MCI work.
Good morning, everybody. I'm Melissa. I'm from the Children's Bureau, and I'm here to learn about MCI.
Good morning, everybody. I'm Judy Sherman. I'm an independent consultant here. I support Strategies 2.0 in their efforts to do these learning communities across the state. And I'm also here to listen and learn from all of you, which I already have this morning.
Good morning, everyone. My name is Natalie Stetz, and I'm a consultant with the Southern California Learning Community.
Sorry to put you on the spot. Your name and why you're here.
My name is Tracy Andrews. I'm from Department of Mental Health, the Prevention Unit, and I'm here because I was told to come here.
And you want to be here.
I want to be here, desperately.
Thank you. There you go.
Good morning, everybody. My name is Blanca Montes, and I'm right here with the MCI group, and I'm right here in grade, and I want to learn about everybody, and then I bring more information for you guys.
Lilia Perez, I'm with the Magnolia Community Initiative. I'm a community organizer, and I'm here to learn more about Strategies 2.0, but also support Blanca and her speech over there at the panel.
Good morning, everyone. I'm Cheryl Naluai. I'm with West Hollywood Community Housing Corporation. I'm a resident services coordinator, and I'm here today because I was invited by Mr. Sam Ju from MCI to talk about partnerships with MCI.
Good morning, everyone. Sam Ju. I'm the director of the Magnolia Community Initiative, or MCI, and we too are a learning community, so we definitely want to also support and, of course, promote the concept of learning together, sharing, and our practices.
Thank you, Sam. So now we want to go to our online audience, and I'm going to look over here to Anissa and ask her to help me do this part.
So we have not heard from our online audience just yet. So participants, please feel free to let us know why you are here today so we can share it with the rest of us here in Los Angeles.
Sure.
So we have Janine Cruz, and she says, I am here as a family advocate in Lompoc, California, and I work for Transitions Mental Health Association. I am here to learn more about the MCI initiative. And then we have Quentin Buckley, who says, this is Christy and Quentin with the YMCA Childcare Resource Service branch in San Diego County, here to learn more about the partnership and get some best practices. And we are going to now try to have our remote sides share a little bit about them as well.
So pretty soon we'll see a video of one of our remote sites.
We have Reza Alcocer from Riverside Unified School District Family Resource Center, Bilingual Family and Community Resource Liaison. She said, I'm here today to learn more about the MCI initiative. We have Veronica, who works at the New Dawn Counseling. We are partners with the First Five Ventura County, providing triple P services. I want to learn more about the MCI initiative. And then we have Mercedes Carmona from First Five Fresno County. Looking forward to learning about MCI and the collaborative model. Good morning. This is Larry Singh with the Desert Hot Springs Family Resource Center. I'm here to learn as much as I can to see what I can bring to the FRC. We have Carrie Collins. I'm here to support our wonderful learning community facilitators and colleagues. Thank you, Carrie. And we have Maria Machuca from Riverside County Community Program Specialist, Family and Farm Workers Service Center. Thank you, all our participants, for sharing a little bit about why you're here and what you do. And now we are ready to get to know a little bit about our remote sites in San Diego.
Oh, were we muted? Okay, I'll start over. Hi. I'm Emily Slapizio. I am the Curriculum Design and Development Coordinator for Strategies 2.0. I'm really excited to be here. I'm looking forward to learning more about our learning communities as well as MCI.
Hi, everybody. I'm Lori Clark. I'm with Strategies 2.0 here at the Social Policy Institute, and I've heard so many good things about MCI over the years. I would like to have that happen in my own home community, so looking forward to hearing more.
Hi, good morning, everyone. My name is Jared Martin. I'm with the California Evidence-Based Clearinghouse, which is also another OCAP-funded project. So I'm here to support my fellow OCAP fundees. And as a former strategy staff, I also have heard a lot about Magnolia Place and have never really had the opportunity to drill into what it is and what that looks like. So I'm excited to learn more about it.
Good morning. Good morning. I'm Angelica Oberleitner. I'm really excited to be here. I'm the program director for the SDSU Strategies 2.0 team, and looking forward to hearing more about the Magnolia Initiative and make connections also here at our remote site, which is wonderful.
Good morning, everyone. I'm Alexa Alcantara, and I'm the Curriculum Design Specialist for Strategies 2.0. And I'm just really excited to participate in my first learning community with Strategies and just to learn more about MCI.
Good morning. I'm Melanie Patton. I'm the Operations Coordinator at San Diego State University Social Policy Institute for Strategies 2.0. And I'm here to learn more about MCI and participate in my first learning community.
Hi, my name is Shannon Strassner. I work with Say San Diego. I'm the program manager for 2 Healthy Start locations in San Diego County. And I am here to learn more about MCI and hopefully bring some of those strategies into the communities I work. That's all of us. Thanks.
All right, thank you everyone from San Diego. Now we're going to move to our San Luis Obispo participants. Feel free to share a little bit about everyone who is participating today.
Okay, hello everyone. We're happy to be here. My name is Gwendolyn Garcia. I'm the program coordinator for Center for Family Strengthening.
Hi, my name is Fernanda Lucas. I work for the Center for Family Strengthening and I'm a parent coach.
I'm Sherry Russell and I'm in early intervention with Pickles and Tickles, birth to 3.
And I'm Wendy Wendt. I'm the Executive Director of First 5 San Luis Obispo County.
Welcome. Welcome. This is exciting. And Wendy, hello.
Hi,
Wendy
Lisa.
Oops, I can't see me because I have to get in the camera. And
I can hear you.
Wendy was so funny. She says, "I'll see you at the learning community in Atascadero." That's where this is being telecasted. And I said, "Well, actually, I'm going to be down here in Los Angeles." And so this is such a great opportunity to expand our audience. And thank you, Wendy, and everybody in San Luis Obispo for being part of this. We had 2 more people show up, and sorry, you're going to have to introduce yourselves to us. That's the way it goes. And I'm going to swirl this around.
Oh, okay. Hi, everybody. Good morning. Oh, do I speak into this?
Yeah,
okay.
You just don't hear yourself.
Okay. My name is Vanessa Diaz. I'm with the Youth Policy Institute here in LA, and I'm a community school coordinator.
Oh, wow. Excellent. Yeah. There was one other person, I think, that arrived.
Hi, good morning, everybody. My name is Rebecca Ramos, and I'm also with Youth Policy Institute, and I am a case manager at our local high school. Thank you.
Okay. Oh, go ahead. Go ahead. Anissa's going to get the microphone and
thank you. And then we have one more participant who would like to share. She said, "Good morning. My name is Tiffany Dillard. I am a social service planner for Riverside County, DPSS, Children's Service Division, Program Development, and FRCs. I'm here to learn more about MCI."
Excellent. So, wow, what a great way to just show to everybody, your colleagues across the state. Even though they're not here in this room, we were able to connect through the magic of teleconferencing. And boy, I'm just so thrilled. Our numbers have really jumped up over the last few months with our learning community participants. And so thank you, everyone who's taken time to be here today. And we're going to move along and thank our funder and our sponsor, the Office of Child Abuse Prevention. So they make it possible for us to have a Strategies 2.0 and all the multiple resources that you can learn about on the Strategies 2.0 website, as well as the trainings, webinars, and of course, the learning community that I'm here talking about today. The learning community is also being recorded. It can be viewed again at another time. And if you want to just share this with some colleagues. And so that is, please remember that that this is like a TED Talk in a way. I like to think about it that way. And as we've developed this, we've been learning ourselves about how to present it in a meaningful way and make it your time with us valuable. So our mission at Strategies 2.0. So like all programs and initiatives, we have a mission statement. And the Strategies 2.0 is a catalyst for the professional skills, organizational structure, and community relationships necessary to mitigate the risk factors for child abuse and neglect, and to promote child, family, and community well-being. And this is a very timely mission statement considering the political climate we're experiencing right now. When I woke up this morning, I actually got on my Facebook page and I posted my commitment to strong families, to keeping families together by changing my framework of my personal picture. And I'm starting to join that conversation as we speak. And we're also thinking about ways how we can engage all of ourselves to advocate that strong families and keeping families together is a core component to keeping children healthy and thriving. All right. Okay, it's going to take a while to take my commands, but anyway, the next slide will tell me something. Here, where's a PowerPoint? So I can keep flowing. I don't know why it's doing that. It's just sleeping. Oh, there it goes. So, yay, we got it. So the growing knowledge of what we want to do is help build upon our growing knowledge and networks for professionals. So all of us are here in some capacity. We say professionals, but we also want to be mindful of our community participants, our parent partners, our parent leaders. You are professionals in your own right. Whether you're a volunteer or maybe you get paid a stipend to be here, or whether you get assistance with travel expenses to be here, you are, in my opinion, a significant part of this conversation, whether you're a community partner or a professional in the field. Training, consulting, and learning communities, this is what Strategies 2.0 is here for all of us, to be able to develop our knowledge and grow our skills. So part of what learning communities is very different from trainings is what we want to reemphasize. We are an opportunity to do these cross-sector partnerships. So Sam today referred to the MCI, or the Magnolia Community Initiative, as a learning community, and they do that. But here we're practicing a learning community across our counties, across our region, across our state. And that's where we want to be able to build this capacity amongst ourselves so we can connect through technology. So you see that my colleagues up in San Luis Obispo County, they are doing the same work or similar work and have the same desires to improve the work and be better at what they do. Also increasing our leadership capacity. So I've been doing this work for a very long time, and I love it, but I know that the day will come when I will stop doing it. And I'm always looking out for those around me that show the same enthusiasm, the same passion, and the ability to just really be very purposeful about their work and not worrying about the paycheck so much. Because the paychecks are important, but it's the purpose of the work that really drives a lot of the folks. And I'm always on the hunt for that, to make sure that when I move on, the legacy continues of the work. Also, innovation and sparking those innovational thoughts. This is what the learning community is intended to be, to think out of the box, to think differently, not just be a compliance-driven organization or compliance-driven service. We want to think differently as new challenges are presenting to us. And also a catalyst for positive change, coming from that place of being strength-based, not just for our families, but with our professional services. How are we supporting each other in a strength-based way is very critical to the work. All right, it's gonna think about it again. All right, I'll look at my hard copy. It will tell me, let's see. Oh, this is the best part of the whole presentation. I want to get there hopefully soon. So what I'm going to show you in a minute is a map of the Southern California region and what we are in that slide when it eventually shows up. And we are very proud to be part of 9 counties in the Southern California region. So San Luis Obispo is the very northern tip of it. And then Santa Barbara, Ventura, and you come down the coast into the great Los Angeles area. And then we expand out to all the others, Riverside, San Bernardino, and Imperial County as well, in San Diego. So it is a huge, it is a huge region. But then we are part of a state that's huge. So I'm part of a team of other 6 regions or 6 facilitators, and they have their own challenges: geographic, traffic, remote areas. Yay, there it is. It's so beautiful. Thank you. And as you can see, the green, the lighter green, that's us in Southern California. So we want to be mindful that we are connected to the rest of the state, even though, let's say, way up there in Del Norte and Humboldt in the very, very far left of the corner, very different challenges, but yet challenges that are keeping folks from really connecting. And we're doing that, we're making these connections with technology and also making a sincere attempt to be out in communities that are rural or remote and not just in the urban areas. That's sort of our goal. 5 million kids in Southern California, over 5 million children. We have, compared to all the other regions of the state, we outpace the rest of the state with having the most children, the highest population. So good thing to think about. All right, it worked, yay. Okay, so I want to move ahead and just do an overview of how we got to this place today, and then we're going to go on to the exciting part of our event today. So I want you to know that at the beginning, we went and we surveyed and we asked, and our very first learning community was done in Ventura, and we asked those who were engaged with us, what is it that we want to do with this learning community? And that's how we build the concept of collaboration. People really wanted to be better at it. You're all being expected to do it. Everybody's being told they have to do it. Mental health has to cooperate with everybody in the nonprofit world. And of course you have to participate and cooperate with the public health department. It's just become, how do you do this work? And you got to bring in parent leaders. How do you do that? So this is what we wanted to do, was highlight what are successful models in our region. And that's why we're here today with Magnolia Community Initiative. We wanted to understand strategies and practices, but also we want to know what is the organizational development piece that's so necessary to make this possible. So our very first one was with Dr. Ann Light in Orange County, and she represents the We Can Coalition. The We Can Coalition is representing the acronym Child Abuse and Neglect Coalition, and she introduced to all of us how they do it in Orange County. We heard from her that we really need to understand what brings partners to the table. We have to seek passion rather than a position. We tend to want, we need the district attorney here. We really want someone in the district attorney's office who's really committed to this initiative. And we have to identify those with influence and learn what they are passionate about. So it is taking time to be relational, making connections, and understand what your passions are that you would bring to that cooperative table. Then in December, we were here at California Endowment, and we featured Safe Long Beach. Now, Safe Long Beach is an exciting, complex collaborative. And we couldn't do it justice in the short time we had together that day. If you have an opportunity to Google it and just get a glimpse into their work, I highly recommend it. And also our day together was recorded. And I think it's going to be posted up on the website Strategies soon. And you can spend some time hearing what they had to share, and we have the PowerPoint on that as well. We're looking at talking to them about coming back again because it was so much information to share. And at that time, we really wanted to have a longer time with them, and we're going to work on that. They really spoke about data sharing and how important data sharing between agencies, between systems. It's very important. Oh, the slide, thank you. And also building relationships and also committing to visionary leadership. So just like I was speaking about earlier about leadership development, they too, in their collaborative at Safe Long Beach, spoke about that nurturing and development of leadership in their cooperative work. And May 23rd, we went to Riverside, and we spent some time in Riverside talking about the development of leadership in that community, but also in all of our communities. And we brought On the Verge, which is an Office of Child Abuse Prevention funded program. It would be for all of us to know that they want to be here in this southern region and be connected to us to help develop your leadership's capacity in your organizations or in your coalition or in your initiatives. So we learned quite a lot from Etzko Kubo. It's an unusual name because she doesn't capitalize her first letters of her name, and we really enjoyed her, and she's someone I really highly recommend connecting with at On the Verge. But today we're here with Magnolia Community Initiative, and what a great end to our year here to introduce this highly impactful work with you. And to start that right now is I'm going to introduce Jose Ramos, and Jose is going to get his mic, who is the director of the Prevention Department at Children's Bureau of Southern California. And it's going to be hard for Jose because I told him he had to stand right here and not move.
That's true. Good morning, everybody. Those of you who are here in the room and also those of you who are, whether in San Diego or other parts of the county, I was told to look straight at the camera and try to look at everybody. So I'm going to do my best, to do both at the same time. I don't know if I can do that. But again, I was asked to just welcome all of you to our learning community learning community. I also welcome you on behalf of Children's Bureau. I have been with Children's Bureau now 24 years. One thing that I was reflecting on when I started Children's Bureau, I started in Orange County in Fullerton. And I was the supervisor. There was just two of us, myself and another worker, with our home visiting program. It was called Healthy Families America. And since then, I never really imagined myself being able to be in front of folks that are outside of this room, right? I just think it's amazing that we can do that. I know that for nonprofits, we're always learning. It's always trying to be innovative. And I really think that this is one of the things that I'm really proud of. And amongst all the things that we are doing out of strategies is the ability for us to be able to connect with all of you that are outside of this physical space that we're in California or in LA County. It's just amazing. And so I'm really proud of our staff and our consultants for their work, their efforts that they've been doing to bring this and put this together. As you can tell this morning, there is a little bit of hiccups, it's not moving a little bit quicker. But again, that's all part of learning. I think there's so much opportunities and so much more things that we can do. I always think that it's our imagination really is what will get us to that point. And I think we can imagine so much possibilities with technology and bringing communities together. That's really one of the things that we wanted to do as part of strategies. How do we bring communities together using technology beyond just the traditional physical space, but using technology? So people who are humble, people who are other parts of our state, how do we do that? So again, thank you for your patience as well, as we work through this, as we work and begin and continue to learn on how do we do this. So just a little bit about myself, just really quickly about myself. As I said earlier, I'm with the Children's Bureau now 24 years. I am the director of our prevention department. Children's Bureau is an organization that has been around for now 114 years. We started in 1904. And the way we started is through really doing a lot of advocacy for children, especially children who were being abused and neglected in LA County. And from then, we have evolved ourselves, our services, our programs through many different ways. Now we are really focused on three key areas as an organization. The first one is direct services. It is through strengthening families and communities. We provide foster care and adoptions. We are a mental health provider, and we do a lot of work around prevention of child abuse and neglect. Our second one is helping other organizations, through capacity building, through technical assistance. This is where strategies falls under. And we've been part of strategies in OCAP for now at least 20 years, 15 to 20 years. And now we're sort of in the second phase. That's why you hear the name Strategies 2.0, so that's the evolution of what we've been able to do with strategies. And finally, we are working to improve and transform communities. Really, that's one of the things that Children's Bureau has embarked in the last 10 or 15 years, which therefore MCI is one of the things that was started. Our former CEO, Alex Morales, if any of you have ever heard him speak, he says that Children's Bureau was the spark that started MCI. So you'll learn more about what exactly is MCI doing and how are we transforming communities. One of the things that we also say within Children's Bureau is that services are critical, but they're not enough, right? I believe that there's not enough funding out there for us to provide every services that we can to every single individual in our county, in our state. So what we need to do is we need to look at it, how do we develop other innovative ways to get and support communities. One way I believe is through the MCI work that we're part of. In the way that our role right now is with MCI is really we are a partner. We're not the lead agency, we are a partner to MCI. So therefore, we are also involved. I'm involved in one of the committees that's called the Ambassador Champions. We have some folks here also involved in our innovation committee based on the reading as well. So I'm hoping that you will learn a lot from our work that we've done in the last 10 years at MCI. And again, I want to just close with saying thank you to the staff, our strategy staff, for the hard work, dedication. Also to our consultants for their dedication and always, looking to strengthen and provide better services and better connections to all of our communities. So if there's anything we can do to strengthen our connections to those of you who are not here, please let us know, share with us, and we're always looking to improve the use of technology and how to connect the communities that we are in. Okay? So I will leave that with you. Again, my last comment is thank you all for coming. I really appreciate your time and your energy that you're with us today.
Thank you. Thank you, Jose. Oh, yeah, well, actually, we're going to hand the baton off to the panel. That's where we're going to start. I'm going to ask our panel to come on up and get themselves sitting. And oops, sorry. And as they get themselves situated, I want to thank Jose for making the time to come be with our group today. And obviously, you hear his enthusiasm. And his vision for this. He also loves the technology part so much that we have sort of a creative idea to expand on our video conferencing equipment here that we'll be talking about later. So what I'm going to do is as always, as we do this, we're adjusting to the camera, which doesn't really move with me, but it is focused on our panel. And I'm going to move over here to the little bit so you can see them. If I stand over there, okay.
And we want to make sure you're in the shot. So.
Yeah, my technical assistants here are giving me some guidance. So what I need to do is, this is what I need to, and you need it too. I'm going to have each of the, can you move over a little bit? There you go. There you go. So I'm going to move over here. Where did I do with my internal agenda? Oh, there it is. So I'm going to have each panel member introduce themselves first, and then we're going to do a series of prompts of questions. So for our audience here, there is some sheets of paper with the questions and the prompts that you can see. And then for our online audience, you will have, you visually see those questions and prompts. And then at the same time, I know Anissa is going to be typing those questions inside the chat box. So our idea here is to have some conversation, and I'm going to do my best to facilitate that, but I'm going to kick it off first by having our panels introduce themselves, and Sam Ju is going to kick this off, and thank you, Sam, for making all this possible today.
Thank you, Lisa. Good morning, everyone. And first, I want to thank Strategies 2.0 for inviting MCI to come here this morning to kind of share our work. So again, good morning to everyone in the room, as well as the online audience.
Good morning, everyone. My name is Cheryl. I'm with the West Hollywood Community Housing Corporation. We're a nonprofit affordable housing developer. We also provide on-site resident services for our residents.
Good morning, everybody. My name is Blanca Montes, and I am one of the parents from the community and also leader from ambassador from MCI.
So go ahead and pass it down to Sam. And so Sam, when we met earlier today, you shared some things about the MCI initiative, and here's your opportunity to talk about the history and about how the MCI came about.
Okay. So I think to talk about kind of the spark, I think that Jose alluded to about MCI, we have to go back to kind of the early 2000s. And it really came out of a strategic planning process at the Children's Bureau. But before I begin about that history, I've been the director of MCI for a little over a year. So I'm fairly new to the initiative, but I was a partner with another organization. So I think very much like organizations that are doing work in our community, Children's Bureau, like Jose alluded to, has been around for over 100 years. And they recognize that, we do great work. And we know we have great services and great staff, and we're really impacting families. But then when they were looking at neighborhood conditions, those conditions weren't changing. And they were wondering, what else could we be doing to really improve conditions and promote child and family well-being? So what started out with a strategic planning process started to move and gain momentum to what we see today as the Magnolia Community Initiative. So we started in 2008, and I think some of the spark and the conversation around the initiative was that we want to take some of the lessons learned from other coalitions and other collaborations to say, we have to make sure that this is sustainable. We know that, prior to starting MCI, many of the coalitions and partnerships were funded. So one of the things that MCI, I think, is just unique is the World Volunteer Network of over 70 organizations. It's a non-funded network. We do get funding from two primary foundations, the Doris Duke Charitable Foundation and the Tikum Olam Foundation. But that is really to support the work of the initiative. And unlike maybe a collective impact approach, the MCI team, we don't consider ourselves the backbone organization or backbone agency. We promote a network theory approach. So we have a leadership body, Jose alluded to the Ambassador Champions, where we invite organizations, senior leaderships to be on this body to help really guide the initiative. So when MCI was launched in 2008, they kind of took a look that we don't want this to be led by Children's Bureau, and they were very clear with that. And so they wanted MCI to really be responsible and accountable to the network. And so originally we started out with 35 founding partners that kind of came together and created the Hope and Dream Statement. And I think the Hope and Dream Statement is not only at your table for our online audience, it's also in the case study that was made available to all of you. And the Hope and Dream Statement was really aspirational, and they want to make sure that our North Star was going to be aspirational, and they want to make sure that the goals or the anchor goals around education, health, financial stability, and strong families were broad enough to be inclusive to all sectors. Because they recognize, like Jose said, that it's not one sector's responsibility to address child well-being or child maltreatment, but it really requires a collective effort to do so. So the Hope and Dream Statement was the foundation, the groundwork to start doing the work. The second thing is that we really wanted to honor the work of our partners. We knew that at that time we were just coming out of the economic downturn, so there was energy around organizations to get together and share resources. And so I felt like the momentum was like a perfect storm for MCI to kind of come together around the table around what does share work look like? We have a shared vision now, Hope and Dream Statement. What else do we need to ensure that there's going to be a collective process to the initiative? So after we decided we're going to honor the work was around, we wanted to make sure that this was a learning community. One of the things I talk about quite often is when I speak about MCI is that if you look at any other sector in our society, the private sector, they have a research and development entity. It's a big part of what they do, but except the nonprofit sector. We oftentimes are driven by contracts and funding and deliverables that are honestly, it's not realistic. Most of the goals oftentimes we have to do. And the time that we have to do it is really based on the length of the contract, right? It's 3 years, 5, if you're lucky, it's 5 years. So we recognize that with MCI, that for us to really to achieve this Hope and Dream Statement, it's going to be a multi-generational approach. We knew this is not something that we can achieve in 5 years, not even 10. So that was another understanding. And the third one was really about, okay, how do we really provide a space for folks to come to the table and to talk about things that are important for them, that resonate with them, and something that they can actually take back to their organization. So this continues to be our challenge today. We really feel that we have to first and foremost promote learning. We have to make sure that we have a data and measurement system that really supports testing of new ideas. Really want to promote innovation and spread. So I think that's a little bit about the history of the work that we do.
Thank you. So I'm going to carry on with Sam and just have him expand a little bit, because what you did tell us about the history and the philosophy that drives the MCI and how it continues to do that. And one of the things you did recently was a community survey. Can you tell us about what you learned from that?
Sure. So a little bit for the community survey, I'd like to share a little bit about the community that we serve. The catchment area for MCI is 500 square blocks or 5 square miles, which includes all of Pico Union and parts of neighboring communities. One of the unique things about this particular area is one of the most dense populations in LA County. And then we have some partners here in the room that serve that community as well. So even though we cover 500 square blocks, 5 square miles, we have over 110,000 people living in that catchment area, which is quite large. And as far as the demographics of folks that are living in the MCI catchment area, we have about 70% that are Latino, about 13% Asian and Pacific Islander, 6% African American, 6% white. As far as some of the things that really feed the initiative is that over 65% of our families are living below the poverty line. We have only about 3 out of 10 kids that are reading at grade level by the time they reach 3rd grade. We have 4 out of 10 kids that are considered overweight or obese. And only about 50% of students graduate high school on time. So that's really kind of what's in front of us and what's in front of the initiative. So one of the reasons that we decided to do the community survey, which we do every 2 years, and we just completed our 2017 collection, was that it was really difficult to get local data. You can kind of break down the county data that's available from the public health department, health services, mental health. But again, they're talking about a large catchment area. So in order for us to really look at, is our innovation, is our strategy, is our interventions really working? We needed to really kind of collect local data. And we want to collect local data around the protective factors. And that was really important for us, because we felt that part of our theory of change is how do we get individuals, families, neighborhoods, and organizations to think differently. And we feel that the promotion of protective factors helps us really elevate child and family well-being. So together we collected and developed questions around the protective factors, around social connections, around resiliency, concrete supports, civic engagement, and public safety. So what the MCI team does, and this year we actually brought in local residents to support us. It took us about 7 weeks to complete the survey process. We took 22 blocks because it's impossible for us to do 500 blocks. We took 22 blocks, which we call the focus area, and we went door to door. And that door to door means that we knocked on 2,900 doors. And we went in the morning time and in the afternoon time. So we made at least a minimum of 2 attempts per household. So we went back multiple times using census tract data. And then we administered the survey and asked these questions. So we were able to get over 500 response to that survey. And so data is only good if it leads to something, right? It's good information, but what does it mean? What are we gonna do? What is this telling us? So what we decided to this year, and I'll allow Blanca in her part of the presentation talk more about it, was we took this data and we did what we call community dialogues. And what we do is we share this information out with local residents as well as partner organizations. And from there, what we're hoping to do is really create the energy and the opportunity for groups of people to galvanize around a particular area that they're interested in. And then from that area, what we want to do as the MCI team is support prototyping of potential approaches or strategies. And so this was our 3rd iteration we started in 2013 and another one 15 and 17. And some of the things that we're learning from this is that, one, over 60% of families actually live in the catchment area 10 or more years. Initially, we had assumptions that many of the families living in our catchment area might be more transient. They may move more often. So that was, again, an assumption that was kind of inaccurate. Another assumption that we had is around the digital divide, that many of our families are not connected. We found that through the survey this year, 71% of families that we survey actually are connected, primarily through smartphone. So what does that tell us? Well, now we can look at broader strategies to not only engage them around information, but around engagement and again, participating in activities that really promote community well-being. Some of the other things that we found out is that many families are still having difficulty accessing services. And there are several reasons why. One is that, well, we don't know about these organizations. 2 is I had a bad experience with this organization. And 3 is with our current political climate, there's fear of going and accessing services because the fear of possible deportation or being the kids being taken away. So these were some of the common fears that people have shared in regards to the community survey. So again, this is allows us to really kind of take this data and use other anecdotal data and qualitative data that we have with local organizations and communities to really test out our strategies.
Excellent. I am looking at Lydia, and you're letting me know there's a question, and we'd like to take a moment and have that question be taken.
One of our online participants wanted to know where they could get a visual, like see the actual survey that was completed and possibly the data.
So let me repeat the question, or have Sam repeat the question for the audience so
Okay.
they can hear it.
So the question was, could folks get a copy of the results of our survey that looks at the different responses? And yes, we can provide that for you. We do have an aggregated survey of all the questions that we've asked and the responses to those questions. So we'll make sure that we get that to the Strategies 2.0 team so they can disseminate to the rest of the partners.
Thank you. So I'm just going to pause for a moment and check in with the audience here. Are there any questions at this time for Sam? Javier?
My question is,
oh, he needs the mic.
The methodology you use in the survey, you mentioned that you did home visits with the residents, door to door. That was a quality methodology, or they just answered a paper, or it was a conversation? What was the methodology to get the data?
So the method was we actually took census tract information to draw down all the addresses within the 22 blocks. So we went by census tract. And then we had a series of questions that on a SurveyMonkey. So we actually had a tablet with a hotspot that we went out. So if the resident was comfortable in responding to those questions, and we had it translated in 3 languages, English, Spanish, and Korean, and they would use a tablet. If they preferred a hard copy, we also had a hard copy available to them. And so the great thing about it is once they do it on the tablet, it gets automatically inputted into our database. And so it's much easier for us to kind of calculate and tabulate the data from there.
Our San Diego State remote site is asking, how does MCI partner with the schools in their area?
So a lot of our partnerships with our schools is around a couple of different type of projects or approaches that we have. First is we have a care pathways initiative, really looking at, how do we, as a network, function in a way that we share, have a shared platform around making referrals for services. And so we've been partnering with 211 LA County for about the last 4.5, 5 years to look at an electronic web-based participant referral and tracking system called CareLink. And so what we do is we partner with not only organizations, but also local schools to be part of the system where then they can have access to over 6,000 organizations that provide services throughout LA County. And the great thing about this tool is that you're able to do it electronically. So oftentimes, and I know we have some case managers here, you have a family that comes in and they said, hey, I need childcare, I need counseling services, or I need parent education. But as you sit down with them and you talk to them, and you start to engage with them and they start to trust you, then you start realizing they need more than childcare. They need more than transportation. They need more than parent education. So what the caroling tool allows you to do is to make multiple referrals at the same time. And what that referral looks like is first is electronic. And long as you're within network, because we are sharing client information, you have to sign an MOU. As long as you're within network, then they will get the information, the client's name, their address, the type of services that they're looking for. And then you can make a referral to a housing entity, a childcare entity, a mental health entity, and they'll all simultaneously receive that. And then they could also respond back to you and say, I received the referral. They can also say, hey, I tried to engage your family, but they didn't show up. Can you help re-engage? So we really want to create this level of conversation. Because one thing that we heard from not only residents, but our organization is that we make referrals a lot, but we don't know if the families ever show up. We don't have that kind of relationship. So part of the Care Pathways approach is to really kind of promote that relationship building. So organizations really have an individual that they have a relationship with, and they feel very confident to make those referrals. Another area that we work with local schools is around the early development instrument. And some of you may be familiar with this particular tool. But it's actually a population level assessment tool that was created in Canada, and they use it nationally in that country, and it's picking up a great momentum here in the United States. So MCI is partnering up with UCLA, the Center for the Healthy Children, Families, and Communities, where we engage local schools in our catchment area. We talk with the principal, and we get his or her blessing to get the kindergarten teachers to do this assessment in their classroom of kids. And once they assess around 5 domains: physical health and well-being, social competence, emotional maturity, language and cognitive development, and communication skills. And once they assess this information, it gets sent to UCLA. So what's unique about this particular tool is it's not an individual child assessment tool. That's not the intent of this tool. What it's measuring is the neighborhood that the child comes from. So then they geocode it to say kids from this particular neighborhood seem to have more vulnerabilities around physical well-being, where you may have an adjacent neighborhood where a child may be coming with more vulnerability around emotional maturity. So what does this information tell us? It tells us what is happening in this neighborhood that is not happening in that neighborhood. What organization is presented and delivering services in a particular neighborhood that is not in another neighborhood. So this is valuable information to organizations or entities like MCI, because our concern is not about well-being of families, but really well-being of communities and neighborhoods. So those are some specific ways that we partner with local schools.
Wow.
So my question is around the survey. You mentioned it's administered every 2 years. So A, I was wondering, how did you land on the 2 years? And then B, how did your funding support the development and administration of the survey?
So I think, like many of the things that we do, the EDI I just spoke about, that is a time over time population level assessment tool. Is done every 3 years. For the community survey that MCI conducts, we also wanted to make sure that it was a time over time study. So 2 years is what, at that time, the decision was made that it would be a good time to see if there was actual changes that were happening in neighborhoods and if conditions were actually improving. As far as the funding piece of this, initially the first wave of the community survey was supported by the Casey Family Foundation. And now moving forward, the last 2 iterations of the survey was supported by the Doris Duke Charitable Foundation as well as the Tikum Olam Foundation.
Thank you. So I can take one more question because then we're going to go to our parent partner and our community partner questions. But we're going to have to take the microphone back to the lady in the back. And then we'll move on after that.
Are you guys a part of the health neighborhoods?
So now we got to walk the microphone back.
Pass it off.
It's a small room, but we're getting our steps in.
We have been, and I was having conversations with some of the folks from Strategies 2.0 earlier, is that in our area, there's several initiatives that are happening together. And I think we're kind of on top of each other oftentimes. We not only have the health neighborhoods that's led by LA County, we also have Promise Zone, Promise neighborhoods that are led by the Youth Policy Institute. Then you have the Best Start communities that are funded by First 5 LA. And we are serving all the same families and we are serving all the same neighborhoods. And I think that's one of the challenges, right? That's one of the challenges, is that how do we align our efforts, knowing that one, not only of sharing of information and resources, but to just make it easy for people to participate. I think the last thing we want to do is have an organization to go to 5 meetings, kind of asking the 5, same kind of questions and looking at the 5 same kind of issues. So definitely, I think MCI has been participating at a very low level, but this is something we're looking at and really looking at an asset mapping of all the initiatives that are happening that cross over into our catchment area, and how do we kind of support, at the same time kind of align our goals.
So I'm going to go here.
So this is the opportunity for us to highlight what our parent partner, and then after that, our community partner. And I want to ask the audience here, as well as our online audience, to continue to write down your questions, so we can come back and ask some thoughts that you might occur as we do this process. So Blanca, thank you for being part of our panel today.
Thank you for the invitation.
And I really appreciate your time with us. And I want to just kick this off by asking you today, how did you become involved with the Magnolia Initiative?
Well, first I'm a parent volunteer in my kids' school for the last 6 years. So I heard from them when they brought us the worships at the school. I got invitation from one of my friends, and I went to the meetings, and I got in there, sit down, and heard and everything. Walked away the same way I get in, and then later on, they brought it back to the school. They get points that I get interested in it. So I went back with them. I started to talk to them, and then they asked me questions, the same I'm doing right here. So I started to get interested. I'm one of the parents in the community. I'm interested to work with my community and change the community. One of the things that I learned from them is how to do the social connections, work with the empathy, because I'm like to be with really friendly with people, but sometimes people, they have like attitudes, and then I started to work with it, and I got some fun, and then I got to make jokes and everything. I got get it too. So I've been in the back and forth, and then I've been in there for around 4 years. So I like to be part of this, and I like it. And then I work with the MCI, and then I was working with them, learn a lot. And then I try to pretend to change my neighborhood and learn, and then get to all these help that they bring to us to see we make the change. And I know we can do it, but we need a leader. So I want to be one of them, because I like to talk, and then a lot of people telling me that it's not easy to be in front of the microphone, but I'm pretending it's only you, and then the other ones, I don't see it, so it make it easy for me. So it's a lot of people to make nervous and everything, so I try to control my nervous. So I'll see if I'm a parent, and then I learn a lot that and we have a lot of necessities. And like San says, we have the problem with the neighbors, they're afraid to talk. So I'll try to see if we can make the connections, and then to see if we can. I have to probably knock the doors with my neighbors. They know me because I've been in there for the last 35 years. So I know a lot of them. So I'll try to see if I can make the connection and try to bring them, and then to let them know all the help of what we have in MCI, because it's a lot of important information, a lot of help that a lot of people, they don't know that they have it around them. So we'll see if I can do, if we can do the change. And then I like that, and then I've been part of that. And also I was the facilitator in what he was talking in the community dialogue. So I have the change to talk to them, and then I learn a lot about that. And then I like the way they work with it, with the community, and we'll see if we can do the change. And I know that we can do it.
So, Blanca, you talked about how you became involved, and you also shared with us how you are an ambassador in your community. And I'd like to expand upon that a little bit. So, what kind of training did the MCI provide you, or Children's Bureau provide you, so you're more confident in your role as an ambassador?
Well, the things that I learned from them and they give it to me is the workshop that they bring it, the agencies that they bring it, and then I learn from them. I have the opportunity to know them and then ask questions and then know what they work with it and then what is the help that they bring to the community and see around my neighborhood what the necessity we have in the neighborhood. So I like to make questions and learn from them, and then that's one of the things that I like from them, that they ask what the community needs, the necessities, is that's what they bring to. And that's the easy for me to learn from them.
Super. Okay, so I think we're ready to take that question from you, but here we need to hand the microphone over. We're learning. I think we might need to buy two.
So we have a question from Atascadero. They want to know what comes out of the data and surveys. What does the MCI do with this information?
So it really is a question for Sam, maybe? Yeah. Okay, we'll take it.
So some of the data, again, is around the protective factors. So when we talk about, let's say, for instance, concrete support in times of need, we would ask questions like, can you access healthcare when you need it? Can you access childcare when you need it? And so basically that information, once we collect that information, the community dialogue that Blanca just spoke about was an opportunity for residents and partner organizations, and this was intentional to make sure that we had both at the table. And what we did is Blanca facilitated, generally speaking, this is the data that we collected from 2017. This is what the local residents are saying about the neighborhoods that they live in. And what we want to do is that from that data, we had everyone kind of World Cafe style, assigned by tables around particular protective factors. And we asked them to look at that data and what is that data really telling you? What's resonating with you? And in hopes that there was organizations and local residents that will be willing to kind of engage in conversations about how they can improve or promote those protective factors in the community. Knowing that our belief is that if we truly want neighborhood level change, we want to increase protective factors in the neighborhood. If we all believe that the presence of protective factors in the home really helps that family stable and be healthy, I think we can make the same type of argument for neighborhood level or community level change. One specific example that came out of our 2017 survey, we were surveying a block called 15th Street in our catchment focus area. And when our staff and residents were going door to door, doing the survey, they were getting very, to be very brutally honest, very upset residents. And they said, I remember you were here 2 years ago and things haven't changed. Things haven't changed. So they said, we're still getting, furniture dumped in front of our apartment building, walk around and you can see graffiti everywhere. I don't feel safe. My child doesn't feel safe. We're stressed. No one's listening to us. So we took this information, both their responses and the qualitative and their feelings around their neighborhood, and we felt like we had to act right away. So we asked local residents that responded to the survey to come to a meeting with a partner organization that does community beautification and graffiti abatement, and our local council member, Gil Cedillo in Council District 1. And so what we did is we helped all those three parties come together, and we did a walkthrough of the neighborhood. And we documented the hotspots, took pictures, and we asked residents, what are the hotspots for you? And so what they did is first suggestion is, why don't we help create a neighborhood watch group? And the residents said, no, we don't want to do that. Because they felt a neighborhood watch group, the gangs would see that as a snitch, a neighborhood snitch group. So they didn't want to be associated with a neighborhood watch group. So they said, we want to create a neighborhood association, not a neighborhood watch group. So a neighborhood association was created. The organization that did the graffiti abatement is looking at cleaning up some of the alleys in that area and doing it in a way that has worked to reduce future graffiti to go back on, but also is really about, again, bringing the community in that particular block together to address a common issue that kind of they share that really, again, impacted child and family well-being.
Excellent. Thank you. I want to continue on. Is there another question? So what I'd like to do is, can we hold that question for a moment? And I'd like to continue with Blanca here and have her speak a little bit more with us. And then we'll pause and hear that question. And then we're going to move on to our community partner, Cheryl, who's with us today. So thank you. That is so important that Sam shared this information and how you were working with the parent partners on this survey or in this assessment process, and what a critical part of that process is to getting that accurate information. But what I'd like to hear from you, Blanca, is what do you suggest to the audience? So you have the audience that is online and sitting in the different communities and to us in this room. And I want you to share with us what it is that we have to do to reach out to parents to get them involved, and what your opinions are and your feelings are about that, okay?
It's a hard question. It's a hard question. My suggestion is, one of the things that we see in the neighborhoods is our education. The safety and the cleaning areas also. But a lot of people try to get involved, but they afraid with our situation. But my concern is if we can bring them places and we can talk to them and let them know that we are neighborhood, we are community, and we need to work together. So if we bring them education, we have to bring them and tell them this is necessity what we have and we can change. And then if we started from the educations, it's going to help a lot, because I heard a lot of people that when I ask to fill out papers, they feel like sad and shy, that telling me that they don't speak my language, that which is Spanish, and it is really, really difficult for them to speak English. So the language is one of the factors that what we have to work on it. So my suggestion is, if we can bring them places, we can bring them like workshop or agencies who can help them to know that they can change and they can learn the language, and this is going to be easier for them to help the kids to do the homework. One of the things that it is hard for them is to help the kids to do the homework. And then I see that in the school when we have the meeting parents conference, and they ask what my kids is slow in the homework and this and that. So we find out that it is hard for them to help the kids for the language. So it's really, some of the people is, for me, break my heart, because I try to help them and I don't know how to help them. So if we can help them to bring these kind of places to make the difference, I know it's gonna know that little by little We want to see the difference. And then another things that I'm focused on for me, and I see my culture is another point that we have a difference. It's a lot of people who knows they have like probably they don't know they have art to do things like manually. They can work in things that they think they can work on, and they have their own job, and that way they can bring money to the homes, and then they can help a little bit the house. Because a lot of parents, most of them mothers, they're telling me that I try to help my husband because he's the only one who work in it, and I don't know how to do it, and I don't have any idea how to bring them. And then if it is a place they can bring us this kind of help, I know it's going to be a different. It's a lot of things that our community needs, but they're afraid to talk about it. So when I talk to them, I feel that I'm their voice. And then if I can help them through you guys, to all the agencies, to everything that you can help them, the community, I'm going to feel welcome to ask you, and then tell them we have the help. The only thing you need to do is to come and ask for them. But like I said, they're afraid to ask. So it is really hard to go and work with them because our situations doesn't help right now. But I'm willing to help them and see if I can learn from all of you guys, and then all the agency that we can bring and help us. I'm gonna be glad if I can put a little bit myself to help them and make the difference to my community.
Wonderful. I'm going to pause for a moment there and take a question or two. And I know there's another question online, but I'm going to come to this table here. And Javier, your hand went up, but your hand went up too. Oh, you didn't. Okay, you don't. Okay, so I'm going to give it to Javier. I thought you had your hand raised.
Well, thank you, Blanca, for sharing your experience. My question is for both of you, for San and you. Did you become an ambassador of the neighborhood by default, or there was an election process? How it was? And also, are you receiving any stipend? Because these require a lot of work, a lot of hours. Then I appreciate all the volunteer work in our community, but like you said, we live in poor communities. We need some financial sustainability for what we're doing, and that's the question for Sam.
For being ambassador is volunteer, is from my heart, and I like to be with the community. And since I was little, I like to help people. And then now that I have the opportunity, so I've been involved in here, and I'm glad because I've been helping people. And when they said, "Thank you, Blanca, for what you brought up to me," and then to let me know where I can do and I can get help from myself and from my family, I'm really glad that I know you. And then, like I said, make yourself free to ask, and I'm your friend. And this is one of the points that I see when you go to the community. Be a friend. It's like I was in the meeting yesterday, and one of the points that I focus on it is when you knock at the door, it depends how do you talk to them. If you talk to them like friendly, you say be nice with them, and then make the connections and let them know that you're a friend, nor a police officer, nor anybody else. So it is easy for me to get the communication with them, and it is easy. So when I talk to people like that, I try to be a friend first, and then after a little bit, as long as you go into the conversation, you started to know the people, and then they started to make free and then comfortable with the conversation. And I said, if you make free and then look at me as a friend. If I can help you, be my guest. I'm right here to help you. So it's really nice to be ambassador. And then I'm really glad that I'm part of the MCI. And I'm telling you, I'm right here to learn. And I'm glad that I'm right here. And I'm glad that Lily and Sam gave me they made me the opportunity to be here. So thank you guys for this opportunity so I can bring to my community what is all it is about it, and all the people that are involved and interested in our community, in the interest in that we are working on it.
Thank you for that question. And I think this is a question actually I'm hearing more and more often. As I think organizations are really recognizing that we have to reframe or reshift our relationship with the community. I think oftentimes when we think about residents, I think the relationship is very transactional. They're recipients of services. But I think, it's MCI's belief that if we truly want neighborhood level change, residents have to be part of that change. And not just, again, as recipients of services, but actually actively being involved of promoting social connections. And residents are the best way to promote an event or an activity or a service. I think they bring a very specific lens of lived experience that organizations and like people like me with maybe content experience, but not context. And so going back to, and how do we adequately compensate, for that expertise and that level of involvement. So historically, MCI has not provided any kind of stipend. We did provide a stipend for those parents who helped us with the survey because that was a significant amount of time that they dedicated to that. But this is something that we're going to be, we're discussing. And I think I would like other organizations to really look at, again, the whole concept of context experts for the work that you do. We were even talking about, oftentimes we make materials like this and we don't consult with the community to see like, does this make sense to you? And we oftentimes find out afterwards that, oh, we probably shouldn't have used that graphic, or that photo was wrong, or that word, even if it's translated, it may not be the right word. So I think, and for this level of expertise, is that part of the cost of doing the work? So I think it's a much, much larger conversation that I've actually heard nationally occurring.
That's exciting to hear, because I'm on the same thought that our volunteers, our promotoras, or our community constituents are experts, and we need to honor and respect that. And how we do that is the emerging conversation. I know there was another question online. I'm looking and checking in with our audience here, and I'll entertain that question. And then we're going to give the floor to Cheryl and let her talk about all the good work she does as a community partner.
So we actually have two questions from the audience. So the first one is from Mercedes. Do you share the EDI data with school districts? With the data information provided, are the districts able to utilize their LCAP, LCFF funding to help support our most vulnerable children based on any finding from the data? And the next question is, can you explain how the CareLink referral system works? Thank you.
I try to be brief with those questions. So regarding the EDI, currently, once the report is completed by UCLA, the individual school report, and so if there is 3 or more kindergarten classes with a specific school, they'll get an individualized report back to the principal. MCI does not get a copy of that report. So what we have to do is, based on a relationship, we have to talk with the principal and saying, are you willing to share out that information with the local parents and local partner organizations? We are currently in conversations, UCLA as well as MCI, and First 5 Los Angeles has really kind of stepped up as the financial piece to really implementing the EDI throughout the LA Unified School District. They actually want to do countywide, LA County. So we're currently trying to negotiate that data agreement. So some of that reports, again, can come back to MCI. And so right now, the funding is primarily being provided by First 5 Los Angeles. And some of that funding includes some additional dollars for the administrative piece of, because there are a roster that needs to be released. There's some things that has to occur. So they want to make sure that that overhead is covered and supported for the school. And then the kindergarten teachers sometimes will receive a stipend. Because they can do the observation at home outside of the regular school time. Some schools decide to give up one of their professional training days so the teachers can actually use that day to input the or participate in the assessment tool. Regarding the CareLink, again, is an electronic web-based system. It's not available to everyone. You have to be part of a network. Currently, is the 211 LA County is in the soft launch stage. So MCI is one of a handful of networks that 211 is currently in contract with. MCI absorbs the cost for that because there is a cost for the user agreements. So currently right now, for our partner organizations that want to participate, they have to sign an MOU. And then we give 2 user agreements per organization. And so again, it captures client demographic information. Once you identify the type of services that you're looking for and you put the address as a zip code, a list of organizations will come up. Currently, right now, what happens if anyone wants to use 211, you have to call. And then they'll either verbally give you this information or send you an email. So a lot of that functions are captured through this kind of online portal.
You're welcome. Thank you. I'm going to just touch base with the audience. Everybody good here? We're going to hand this off to our next panel representative. But before I do, we're going to do this till 12 o'clock. So we want to be able to entertain more questions also during that time. But at 12 o'clock, we will wrap it up. And we're going to do some evaluation discussion, and I'm going to be polling the audience here to ask some questions, and then we'll close out the day. So Cheryl, it's your turn. And as a community partner, we are so excited to hear from you. And I just met Cheryl for the first time today, and please reintroduce yourself to the audience and who you're representing today, and thank you.
Thank you. So I'm with West Hollywood Community Housing Corporation. We're a nonprofit affordable housing developer. We also provide on-site resident services, programs, and activities for our residents. And we have a new building, it's about 2 years old now, on the border of Koreatown and Pico Union. So fortunately, through connections with Sam and the Children's Bureau of Magnolia Family Center, we were able to join. We have the privilege of participating as one of the community partner organizations. Sam was speaking earlier about CareLink, and that's initially how we were brought into the organization. We were asked if we would like to participate, being a new nonprofit in the area, in the Koreatown Pico Union area. And we were excited because CareLink provided us with, being new to the area, CareLink provided us with the resource where we could connect with service agencies in the area and with other partner organizations within the CareLink group at MCI. And one of those partners is Para los Niños. Many of you here in LA may be familiar with that organization, and through Para los Niños and our partnership with them through the CareLink partner organizations, we have been able to have our client residents participate in a really good neighborhood leadership group program that they have at one of the local service agencies in Koreatown. And through that, it's another program like Blanca was talking about, where the neighborhood parents get together and they learn leadership skills. They learn how to advocate for their schools. They learn how to advocate for their neighborhood safety. They, in regards to safety, they partner with activities with the Olympic Station, LAPD Olympic Station, right down the street. It's a really great program that has benefited our residents and has brought connection within the buildings within our area. There are 2 other affordable housing buildings within 2 blocks. So there's 3 of us within a 2-block radius. And we have formed a housing collaborative, and our residents within the community partner to do different projects. And then we partner with the local neighborhood association at LAPD Olympic Station, with Magnolia, with many services in the area. So it's been vitally important for us as an organization to participate as a partner organization. Another example is through MCI's innovative reading group. We are able to partner with their staff and start a parent-child reading program where the goal is to have the children and their parents, or the child and another family member, reading on a daily basis. That's the ultimate goal of the program. And MCI and the Innovative Reading Group staff have been instrumental in getting us to start that at our site. And also through the MCI Innovative Reading Group, we have made contact with other organizations in that group, like Jumpstart. And Jumpstart is a national nonprofit that utilizes college students and community volunteers to facilitate reading programs to prepare children for kindergarten. And so that partnership, they're coming on site to our site, and they're doing a reading tree activity with different activity centers, and helping us again to promote education and reading and early childhood development within our residents, and hopefully within the other housing collaboratives that we work with within the 2-block area. We also, through SAM directly, we make connections with Ready for Routines, which is through the Center on the Developing Child at Harvard University, facilitated by the Westside Infant Family Network, and it's a parenting program. It's an 8-week parenting program. They'll be on site with us and doing parenting engagement, and it's a curriculum to help develop positive routines and support early learning for children 2 to 5 years old. So these are all really crucial programs that we're able to provide for our resident clients through this really great partnership with MCI.
So thank you, Cheryl. I'm going to just check in with the audience to see if there's a question here, or even with our online audience. So Cheryl, since I don't see any questions at this moment, I want to, I know you talked about your relationship with the partners. You talked about your relationship with the neighborhoods. Can you talk specifically about your relationship with the Magnolia Encampment area and what that looks like today?
So we have, again, we've only been in the area for about 2 years. So we've been promoting within our residents and our clients a lot of community and civic engagement, because they're new to the area, most of them, and getting them to be involved and be advocates for themselves, for their families, and for their children. So a lot of the things that we do is promote participation in the neighborhood association. And that group is volunteers, and it comes from the community, and it's led by a leader who's been in the community, Koreatown, Pico Union area for many, many years. And they do projects, beautification projects. They do, they explain and understand community safety initiatives. They work hand in hand with the LAPD. There's always a lead officer from LAPD there in the meeting that they can talk to about parking issues, traffic issues, street vendor issues, um, just all types of issues in their neighborhood that, like some of what Blanca was talking about earlier. And it is a small group of residents because, like Blanca was saying, there is a lot of fear of putting your name on a list, and if you're not documented, or a language barrier. But through community leaders, through parents, through it's all community led, they those leaders are the ones that can go out and allay those fears from the residents and get them to participate and slowly get them to understand. So our connections with the neighborhood is really, really important. We also have a connection with the LA Fire Department's their CERT team, which is the Community Emergency Response Team. They come and do a workshop on site to talk about emergency preparedness and how to prepare your family. And so getting our residents to engage with the fire department, the police department on a very safe way, or very cooperative way, having them come to our monthly resident client meetings, talking about neighborhood safety, getting them familiar with who they are, so that the goal is to get them to be less afraid and to be more engaged in the community. It's a really important focus for the area, for the community.
Excellent. So I think we have a question. So we'll hand the mic over.
So I guess I have two questions. One is, what percentage of the population in the catchment area that you're aware of kind of moves in and out, and what percentage of the population has been there for a long time, or maybe their family has been there? And then in conjunction with that, is this area of Los Angeles so densely populated because, let's say, housing is inexpensive, or did it develop that way for some other reason? I'm just kind of curious about how this catchment area became what it is today, and any information that you have about that.
I could just briefly speak about the data piece of it. Okay. 65% of families, again, live in that catchment area 10 or more years. 95% of families that live there are actually renters. So that's kind of the demographics of folks that are there. And there was one question about the renter, if it's changed throughout the years, the population. Okay, yeah, I think with gentrification, we're also impacted by that. So I was surprised to see in the 2017 survey that primary language, English, went up drastically, significantly from 2015. And then when our team went out to canvas, they found buildings that weren't there in 2015. So the multi-family housing. So a lot of it is an issue of space. Again, Pico Union is home to the largest Central American population, I believe, maybe even the country, I want to say. And I'm sure MS-13 has been in the news quite a bit. The birth of MS-13 was Pico Union. So I think you have a large group of, communities of colors that live in that area that are impoverished. So multifamily housing tends to be what's available, not necessarily affordable, but what's available. But I'm sure Cheryl and Blanca can speak from more of a personal experience.
So for our new housing development in Koreatown, Pico Union area, I would say that the majority of our residents are from outside of the area. We do have some families that are within Koreatown that were living in that area that moved into the building because the rents were going up. A lot of them moved in because they were living over capacity, staying with other families and friends, and they were over capacity and were at risk of putting that family that they were staying with in jeopardy of losing their housing. So they were trying to find housing. But they are, the majority of them are not English speaking. They're Korean speakers or Spanish speakers. And they were referred to our application process through the service agencies that we reached out to within the Koreatown Pico Union area. So we did get a lot of referrals from that area, but some of the agencies like the Children's Institute, Children's Bureau, St. Mary's, their catchment area is really wide. So we were getting applicants from as far as South Central LA and a few from the Valley and from Metro Los Angeles.
So we have a question over here and a question over there, but I just wanted to let Blanca say one thing about the housing discussion here, and then we'll go back to you, Judy, and to you, Javier.
One of the things that we find out during the dialogue that we have from our community is the economy. Because like I said before, it's just one parent is the one to bring the money. So the rents are really high, so they don't have places. And then those are the opportunity for them to live combined with other families to just try to not to be comfortable, but it's not comfortable to be and enjoy with another family the space. So our community is kind of like looking for not safety place, but like try to help and share with the parents, with the partner, to be like more like, I cannot bring you money, but I can share this, go with share with the family. So that's the only problem we have in there. We are poor areas, so that's more of the majorities have the economy. So that was is like she said, that is a lot of community is really wide. So we need more spaces, but it's a lot of people who can afraid to ask for it. And one of the things is our, like I said before, like our political problems. There's a lot of people they afraid to go and ask because application asks for papers, and then the language is another problem we have. So they're afraid to go for it. So it's really sad that our community is doesn't take the help, and then because they are scared. They're afraid.
So I'm going to take the microphone to Judy, to over here. Would you like to stand up here? That way I don't have to move the camera. No, you don't.
Just a quick question, Cheryl. This is sort of a question from an organizational partner perspective. So you said that you've been a partner with Magnolia Place Initiative for a couple of years. And given that their focus is specific to that catchment area, as a partner coming in, what's that like for you? Do you say, well, we're going to serve those families in that catchment area, or because we're a partner organization, we have other families that we serve, and what's that, in either way, what's that like for you as an organization?
Thank you, Judy. Well, our building, we have a 40-unit building, right? That's our first building in the area, and it's right on the border of the catchment area, fortunately. So we are, included in their area. So we're able to focus our residents in directing them to MCI for service, because they have multiple services, multiple programs. And so with this connection, we can be specific in directing them there, but we also can be specific in directing them to the Koreatown Youth Community Center, the Koreatown Immigrant Workers Association. Those are the two buildings that are within the 2-block area of us. And so in answering your question, we're privileged to be within that catchment area so that we can participate directly with MCI and provide all the services and get our residents and clients to be involved as a community volunteer, as a community parent, as an engagement in their programs. And a lot of our residents were already participating or already clients of MCI before our building was built, and they were already familiar with it. In fact, some of them told me about that agency before I knew about it when we were moving in to the area in 2015.
Javier, we're going to get the mic over to Javier. And
Well, I have two questions. One is for all of you, and the second one is for Cheryl. My question is about how you handling with indigenous communities, because in the last decade, I'm seeing, especially in Pico Union, an increase of indigenous communities coming, and they don't primarily speak Spanish, even though they're from Mexico and Central America. You know, Cachiqueles, Quechí, Quichés, Canjovales, also Zapotec, Mixtecs. They are coming, Triquis coming to live in the Pico Union area. They don't speak Spanish, and they don't speak English too. Then how you handle that population, how you're approaching to them? Are you looking for the organizations to support in this effort with you in translation too? And my second question is for you. You mentioned the police, and I know this is a really critical situation right now, especially for the violence that we have and the distrust the community has for the police. Also, when you call them, they don't show up unless if someone is dead. And I know a couple of years ago, a Quiche brother was killed by a police officer who was not, who was cleared by the justice system too. Then it creates a lot of things. I don't know how, what strategy you're using to get the police with the community together, because it's really hard.
thank you, Javier.
Just quickly on the indigenous community, we have some organizations that have the capacity. There is the Central Latino for Literacy. That's also in the border of our catchment area. But in all honesty, it hasn't been an issue that we have been effective and really trying to address, especially around the capacity of services. So it goes back again to the system. And so one of the things that MCI we hope to do is, again, as we function as a network, and as our network partners are sharing, you know, we're seeing these patterns, we're seeing these things kind of emerge. And then as a network, how do we kind of support that area and that capacity? But, you know, we, need to do a better job. But that's because that's something right now that currently we're not actively engaged in. But as you mentioned, I know it's a growing issue.
So it's definitely our residents, clients' relationship with LAPD is very fragile. They're very, very afraid. So one of the things that we've been doing from the very beginning when the building was built was having the lead officer. There was a lead officer assigned to our block area, and we had him come to the building, meet the residents. At our monthly resident meetings, he would speak about community safety, how to keep your vehicles from being broken into, because that was a big issue in the neighborhood. How to keep your children safe, how to keep, walking to school, coming home from school, just daily safety skills, safety tips. We get them to be familiar with him. Know who he is, he passes out his business cards so that they're still not brave enough maybe to approach him directly, but they know who he is and they'll wave at him and say hello. He's come back multiple times, especially when with this new administration, and their fears about immigration, deportation, ICE, all of those issues, he would come and explain LAPD's position on that and how they're completely separate, and allay the rumors, the fears, some of the general community misconceptions about what LAPD does and what ICE does, and get them to trying to encourage them more to go to the neighborhood association, not the neighborhood watch, but the neighborhood association, where they can have a lot of input and ask questions directly to the police. There's not just the lead officer, there's also other sergeants and other officers from that block, Spanish speaking officers, Latino officers, female, male, and they come to these meetings there so that people can talk to them one-on-one and not be afraid of them, not be afraid to talk to them. They're also very involved in the neighborhood association's community cleanup projects. They're there painting the murals right alongside the families and the residents in the communities. They do a lot of community outreach at their center, where they have an annual Christmas festival there. They have shoe giveaways there. They have toy giveaways there. They're at the local schools, elementary schools that are right around the police station, the high school down the street. They try really hard to be visual because they don't want the residents to be afraid of them because of the misconception that they are with ICE, that they work with ICE. And they also, but they realize there's just, there's a lot of fear, and the fear is always going to be there, and there's always going to be a lot of misconceptions and a lot of misinformation that goes around the neighborhood. But this particular station within Koreatown, that's right across the street, tries really hard to be involved in community engagement. But like you said, there are times we've called them and they haven't shown up. And our residents have called them and they haven't shown up for whatever reason. But we have our lead officer to go back to and say, why did this happen? Why didn't this happen? And he can always give us an answer. Not always a satisfactory answer, but he gives us an answer. But also, they're very familiar with our building, with our residents, with our families that have continual challenges and have multiple calls to the police department. So we work with them to get them to know who we are, the staff on site, to get familiar with the residents. And it's a really, really important part of having families in the community just feel safe, where they are, because safety is number one for our families.
Let's have Blanca speak to this, and we'd like to hear what you have to share.
Well, like Cheryl says, yes, it's a fragile part of the neighborhood, being connecting with the police department. And also, yes, I'm familiar with that too. They have groups, they have meetings. As far as I know, it's 2 different ones every 2 weeks. So I see a lot of people working with them, and I know a few officers. They go to show us how to be safe and then give us a tip how to be connected with the neighbors, with the residents. And MCI frequently invite them to be like part of that, to be like friends with them, and the kids also get familiar with them. And then I got my experience with my kids that the little one was a little scared. So as more he sees them, so it's get like more get together with them and then talk to them, and they like to be part of that and then show to the schools. And my school, when I'm volunteer, they usually go frequently and then walk around the school, invite kids, and then asking them to ask questions to them, to be like not scared to ask, because they are to be like friend in it, to show them that they want to be like, make sure that everything is safe around the school, inside and outside the school. So it is really nice because I'm seeing them frequently, more frequently now that we have it like close by. So it's really nice if they have that contact, because like I said, it's really fragile topic. And then it is sometimes for the police how to handle the meeting, and then the connection with the kids is really nice. But with, like Cheryl says, we try to be like, make the connection with the neighbors, with the community, and with the residents, especially with the kids.
We have a question in the back, and I'm going to walk back here. Okay, I won't do that to you.
Thank you. I have two questions. One is for Blanca. My question for you is, how large of an area do you cover as an ambassador? And my next question is for Sam. I know you have over 70 partners in the collaborative. Could you give us an example of the type of mix of partners that you have?
We'll go to Blanca first.
My area as ambassador, I can tell you, is probably don't have limit, because I can go back and forth, because I'm getting involved with the region's commitment right now, and I went to the meeting yesterday, so I went right there, South Central, like 88 and Avalon. I didn't have any idea, but I went there and then met new people, and I don't have limits. If I can go to Bali, whatever they ask me to go for, I'm there. So I usually my area is from probably Jefferson to Olympic, from Figueroa to Crenshaw, whatever. So I have friends around the neighborhood. So for me, it's not a problem with that. So like I said, no limits.
So we have a cross-sector partnership with our network of 70 organizations that represent the health sector, federally qualified health centers, to programs like Champions for Change that really look at environmental factors of when it comes to food access, food deserts, to organizations that deal with mental health depression, to behavioral health, social service organizations that offer after-school programs around education, both early childhood, middle, and high, and organizations that focus on advocacy. So again, it is really important to have that cross-sector partnership. And you could take the example of child obesity that I had shared earlier on about 4 out of 10 kids in our community being overweight or obese. And initially you think, oh, let's just have them eat healthy. And then that leads to the question of food access. Then that leads to the question of park or green space for children to exercise, which we're the second most park poor community in LA County. Then the issue of public safety. Do the families feel safe for the kids to live outside? So if you just follow that thought process, it really, again, requires a number of different perspectives to be at the table to address this one issue.
More questions. Good.
I'm just going to piggyback on Lita's question. Do you have members of the business community engaged in the initiative, and or have there been efforts to engage them?
So currently we have one private sector partner in our leadership body, which is Union Bank. They're also located in the Magnolia Place Family Center. This is kind of a pilot project for them to have a kiosk there. We're also trying to engage more with the LA Chamber of Commerce, who is also supporting the early development instrument. They have a very investment. And then we have some local businesses that support, but I think it's, again, trying to figure out when we talk about, community well-being, what is the role of local business owners to contribute to that? We know many of them participate at local neighborhood councils that are funded by the City of Los Angeles, but oftentimes a lot of their ideals and recommendations are really focused toward the business community. It's about, changing the facade or street cleaning, but we want them to be more cognitive and more focused on, again, things that local neighborhoods need.
So our online community is asking if the block captain approach is still being used.
I didn't share about the block captain, but it was part of kind of a campaign that we did several years ago called Neighborhood Circles. And the idea was, the question that we had is, how do we promote social connections within the neighborhoods? So we want to identify parents like Blanca who would be open to kind of taking her block, her area, to invite families into her home where MCI staff would go and kind of co-facilitate dialogues around protective factors and the importance of protective factors. And although we started seeing some promising results from that, it really became an issue of capacity. The MCI team, there's only 7 of us in total. So we don't have a large team. So although we can get more parents, it was difficult to have MCI staff team be present in those neighbor circles. But the curriculum that was developed, we felt was very promising. So the 2.0 version that we're considering is, could organizations take that on? Can organizations work with local residents that are in the hub of their center or their facility as kind of block captains? So that's kind of where the exploration is currently right now.
Okay, so I'm going to check in with our online audience first to see if there's any more questions. And at this time, and also with our audience right here, any other questions we could take from you today? Okay. Oh, now we have another question. It comes.
It's from me.
Oh, it's from them.
So I know we talked a lot today about the different ways that we try to promote community engagement and collaboration. How can we, as different parts of the agency of all over LA County or from San Diego, from Atascadero, how can we help promote what you are already doing and help increase parent involvement? How can we as agencies take maybe one thing back with us to the agency and the people that we work with to help promote what you all are already doing?
Someone want to speak to it? Okay. Okay, I'm gonna let you go first.
Okay. Well, the first thing that comes to mind to that question is collaboratives. In our case, collaborating with MCI, collaborating with Koreatown Immigrant Workers Association, Koreatown Youth Community Center, St. Anne's, Para los Niños, on and on and on. Those agencies that are right there within you, those collaborations have been vital to getting the resources and services that our clients need. So for my part, being new to the area, when a couple years ago, we just went out to the neighborhood and we started with one agency and talked to them about who do you know, and then we found MCI, and then we found all these other connections, and then we just kept making connections. And now the list of services agencies that we work with is large, and it's going to keep growing the more connections we're making through MCI and the partnerships that we're making as our focus changes, different things from education and safe community safety, community engagement. As different focuses change, priorities, we'll continue to make contacts, and it's specifically trying to reach out to those that are closest to your site, because as we found, it's a challenge to get our resident clients to go far, away from their home, or even 5 miles away from their home to receive the services that they need. So collaboratives and partnerships, it's been vital.
On the question of resident engagement, I think it's really kind of having each organization or each network really define what that means. I think people define engagement very differently. Some people think engagement is, hey, we ask them how we're doing as an agency, how did you like our service? And we do that every year. So that's engagement. Another engagement may be, hey, we do events, a holiday party, and we invite residents to come. That's engagement. What I think MCI, what we're really trying to promote is authentic community engagement. What does that really mean? How does organizations or network work with residents in all aspects of the work? And I think the first thing that as organizations, we have to kind of check our own biases, what we think residents can or can't do. And I think when we were talking about the community dialogue, I think initial impulse was, let's have staff do it. And then we had to really kind of challenge our own assumptions. Why couldn't residents do it? Like Blanca, she did a fantastic job to leading the community dialogues. People think data is something that only organizations or evaluators can talk about and really could understand. So I think it's really kind of broadening that definition of engagement and really saying, how do we utilize residents who are tremendous assets in neighborhoods and communities, in hoping and helping to lead community level change.
Lots of questions. Is there any participation from older youth or college students to encourage their future civic engagement efforts?
Very good question. When MCI started 10 years ago, a lot of the efforts were on early childhood. But we have more organizations that are doing youth services. We have a local high school that offers a leadership program. So there's been some conversation with our local partners that do youth leadership programs about how do we actively work with young people to get them civically engaged in issues and things, very much like parents. Again, what does authentic engagement mean with that population? In regards to college students, we have local universities like USC and LA Trade Tech and LACC's there. So we do have some college students that work with our network organizations. I know that Jumpstart, one of the things that they do is they actually bring on seniors to be present and using that kind of intergenerational approach. And then they also actually have college students as well. So I wouldn't say at a large level, but these are some things that we're exploring.
So I'm checking in on the time, and I think we're ready to wrap up. And please, if you have any questions, I'm going to let you ask them now. Seeing none, and
or forever hold your peace.
So I want to just take this moment to thank our panel. Thank you so much, and I appreciate you taking time in your busy schedules to be part of our day here and to introduce yourselves, not just to the people in the room here, but to our audience out at our online community. So I'm going to wrap this up with a couple of things. I want to remind everybody that this is just the end of this year, but we're going to start this routine of having learning communities and a sequence of them in 2018 and 2019. And we plan to have 4 regional convenings. We're going to be spending some time picking those dates today. Also, look at the possibility of any one of you in our audience, would you consider serving as a hub for us, a remote hub? Like we're here today, if there's a place in Los Angeles, maybe over at your place, that you could host a hub for our next learning community. We would love to talk to you about that possibility and how to establish that relationship. And also, I just please encourage your commitment to this process and your participation. It's something that we are here to learn together, and that is how we build this capacity to improve upon our learning communities, but also going back home into our neighborhoods and advancing our initiatives, not so much for the political reasons and the right reasons, but because it really helps us engage in a more meaningful way with our fellow neighbors and people that we work with. Please go to the Strategies website and encourage and help us shout it out to others, because the Office of Child Abuse Prevention has made this possible for us. And if we don't use it, then it won't be around. So please help me do that and to share that widely in our communities. And sign up for the newsletter. There is a great way to stay connected to us through that way. Request or enroll for trainings. And enroll in our learning communities that we'll be doing now in the 2018-19. Newsflash, you don't have to do just Southern California. You can engage in a remote way at any other of the remote learning, other learning communities in the Bay Area or out up in the north coast of our state. So visit the site and get familiar with that. Might be a topic you might feel that's resonating with you in your neighborhood, and you can participate online for free. And thank you. Thank you so much. We want to ask you before you leave a couple questions, and then I'm asking you to please fill out the written evaluations before you leave. And Natalie, can you help me capture some of these answers over on the pad? I'd like to just poll the audience quickly, and an online audience, I really would like to hear from you as well. So I would like to hear quickly, what did you come away today that you understand better about what makes the MCI or the Magnolia Community Initiative successful? I have one right over here. Yay! Go ahead. Oh, we need the microphone.
For me, and I'd met Sam before, but I don't think I really understood the degree to which MCI is committed to partnering and engaging with the community, that it's not a service for the community. This is an initiative of the community. It's really impactful to hear from Blanca that she's part of this, a real integral part of this, and she puts everything she's got into it.
Thank you, Blanca. Thank you. Is there anybody else would like to share what they took away from today on what makes this Magnolia Community Initiative successful? I guess we have an online contributor to this question.
So we have our Atascadero remote site. They said they are engaging and really listening to the needs of their residents.
Okay, excellent. Jose?
So for me, it just reaffirms, strengthens that the importance of using data, right? It's really important in not only getting the data from the community, as Sam talked about the survey, but then going back and talking to the community about the data, you know, and then having whatever comes out of that, but at least that the importance of closing that loop. I think it's really something that just Sam, the panel members reaffirmed that we gotta really use data but make sure that the data is given back to the communities.
I'm going to piggyback on that because I think updating the data is really important because sometimes when programs start, they'll do a data catch in the beginning and they'll be serving a community for 10 years, not realizing that populations change, people's needs change, resources change. So that piece and taking that on, I felt very inspired that you're really thinking about your community in that way. So thank you for doing that.
Hi, I think one of the strengths that MCI has is actually, I agree with everybody else in terms of the data, in terms of the participatory approach that we are having with the community. But I think I want to wrap it up more into the listening word, because I think they are listening. And I think Blanca was truly inspirational. And I really feel inspired by everybody's work, by everybody who is hitting the room in wanting to listen what is out there and how we can actually find ways to fulfill the needs of the community. And as a matter of fact, I would like to actually not only say thank you to every one of you, but I actually want to invite Blanca to our coalition, to the Food Marketing Coalition. We work in terms of food justice, in terms of access for the well-being of the community. And I think you have a true testimony as to how impactful your volunteer work is out there. And I think many other community members could definitely feel empowered by what you have to say. Thank you.
Thank you for that. We got another one over here.
I think that using data and community engagement are the two hardest things for nonprofit organizations. Programmatic things, many of us have figured out how to do. We figured out actually how to even evaluate programmatically and say, as a result of this program, this is happening either to individuals or to a group of people. But I think in terms of bringing the two together, the example that we've heard today is a big step over that. I know there are other organizations across the state that are also doing that, but they're the two little nuggets that I know are really sometimes out of reach, but when they're put together, they are so amazingly powerful. So thanks for that example.
Anybody? Jose put his hand. Oh, go ahead, Natalie.
Oh, one of the things that really jumps out to me about the success of MCI is the commitment over time. You know, sometimes it takes time for things to change, but that commitment over time coupled with the partner relationships is creating something that can actually live on, even if funding for the leadership were to go away. That there would still be this Magnolia Community Initiative thing existing maybe in 10 or 15 years in another way. Really cool.
So just to add to the data comments, I think one of the other things that I enjoy and appreciate with MCI is that they're also looking at population data, right? We typically nonprofits, look at individual data outcomes. Did the child do this, or did the family improve in this, or did the individual, which is great. I think that's something we have to continue to strengthen. But I think Sam mentioned the EDI. The possibilities are endless in terms of learning about a community, from community data, rather than individual data, which, I mean, I think that to me is something that's very unique. I haven't seen, at least not in the traditional nonprofit world, of looking at community data at such a scale, and then I think we'll have some, opportunities to learn so much about the community through the EDI, that is just amazing, and so anyway, so that's an additional.
One thing I really appreciate about MCI is the multi-layered approach in really engaging and building capacity in multiple levels. So Sam had mentioned the executive leadership kind of engagement. There's, of course, the family and resident engagement. From an organizational level, there's opportunities for organizations to come together and learn how to impact the community in a collaborative way. And also, which wasn't mentioned today, but the MCI fellowship as well, which really looks at both direct service staff and also early mid management level to help lift them up and in turn, lift up the community as well in a learning, with that learning opportunity. So just there's so many ways to be involved in this initiative. And I think that's one thing that's really unique about this particular effort.
Thank you. Okay. Excellent information. I just want to just check in. How did anybody learn from this experience? What did you learn about how they address their obstacles? So there are obstacles. Was there any aha moments in the audience about how they do this? Kika. Kika, you gotta take the mic.
Oh, I'm sorry. So here, she's a volunteer. She doesn't have no salary, no stipend, but it's the commitment and the decision to make a change in the community. So this is really amazing. In my program, in the Child Development Center, we have parents as well as the volunteers. And having you in the community, in reality, is making a big change. So there is a saying that an ant can be the mountain. So you can bring another people as well in your community and keep working, with the MCI and with this partnership you have with other people as well, involve more people.
Thank you, Paquita. Anybody else like to share that?
I have something. When you were talking about how you came back 2 years later and people were like, nothing's changed, and the fact that it was like, okay, what do we need to do to have something start happening right away? I think it's pretty amazing, because I think sometimes people sit on data and they're just like, let's figure out this plan that takes a long time. The fact that stuff was actually happening to really address the concerns, it's like that's how you build trust with your population, is showing like, we're not just taking data, we're not just saying we're going to do something and not really doing it. So I think that was something that I really felt was really a great way to do what you need to do in that community and build that trust.
Thank you. Anybody from our online audience want to share? Oh, I guess we do. Thank you.
We had the San Diego State, they mentioned that they really appreciated the idea of broadening the definition of engagement in the community. And I think that's something that Sam shared. So thank you for that.
Okay. Hand the baton over.
Sam, I really like that you're considering stipends for your key volunteers, and that you actually provided stipends for people who were doing the surveys, because I think it's important to start having that equity for the work, we hold up the expertise, and I think that that's an equity issue.
Thank you, Judy. So I'm going to just ask one more thing of the audience before we move on. And that is, I would like to hear from just a couple folks. What is the difference between a learning community and a training? Can anybody tell me that? Oh, Paquita.
I think learning community and get training is really say two different things, because when you go to the training, you have just one person is teaching you or telling you what they do. But in the learning community, you are learning from everybody here, from the panel, and even the audience that is behind the camera. So I think it's more enriched. You can get a better view of what they are doing out there, because it's not just one person is telling you what they're doing, but it's many other ideas, and we learn so many things here from them.
Thank you, Paquita. Is there anyone else like to share? Oh, I'm sorry. Was there somebody else? Oh, did you have a comment? Okay. Anybody else from our online audience? We do. Yay. I struck gold.
So we have San Diego State, who said learning community is an exchange. We spark with each other. Everyone brings something others can benefit from, and all can take away new ideas. So that was their definition of a learning community. Thank you.
Thank you. Anyone, Lita? She's going to get mad because I'm going to put the camera on her.
I just wanted to add that a learning community has more elements of a call to action, which makes it a little different from a training.
Thank you, Lita. Okay.
So Sam, I really was inspired when you talked about there being kind of a research and development component within a learning community, or that's a possibility. I heard somebody say this a while back, and it really struck me that it's socially acceptable to go into copious amounts of debt to go to college. It's socially acceptable to take risks in business and sometimes lose millions of dollars. But if you take a risk in the nonprofit world and it doesn't work, there's all this shame around it. Yeah. And so giving ourselves a chance to really come together and learn and toss around ideas and maybe make mistakes and talk about them is so important. And nurturing that kind of a culture, I think, can really help us grow in the field.
Thank you. All right. One more check-in with our online audience. No more? Okay, folks. Panel, thank you. And thank you everyone for being part of this day with me. Happy summer solstice. And in evaluations, please submit them and we'll be in touch. Thank you. Yeah. Signing off. Bye. You're a hero. You're a star, Blanca.
Thank you.
Thank you again.
Appreciate that. Give me the opportunity to meet all these people.
Well, you really, yeah, you have wonderful leadership skills, and I think Sam should give you a raise. Yeah, there you go.